Have you ever been punched in the face? Do you have diabetes? Did you start a new medication? Or are you not sleeping that well? In this video, we're going to be talking about what it means to have blood in your eye. Blood can exist in the front, somewhere in the middle, or somewhere in the back as well too. But let's start with the front of the eye. So in the white portion of the eye specifically, what does it mean to have blood in the white portion of your eye, known as the sclera? Right above the sclera is the conjunctiva, which is an invisible connective tissue that can kind of trap the blood in that little pocket zone. What we refer to this condition as is known as a subconjunctival hemorrhage. This just means that the blood is located underneath the conjunctiva, the connective tissue we talked about a few minutes ago, and then right above the sclera, the white portion of the eyes, because you have blood vessels, veins, and arteries that travel the span of your entire eyeball. And what happens is that as the blood moves further into the front of the eyeball, sometimes some things can cause one of the blood vessels to burst, whether it's an artery or vein. And a couple of the causes can include some of the following: violent coughing, powerful sneezing, straining, or vomiting. In some cases, a subconjunctival hemorrhage may result from a type of an injury, whether you're punched in the face, a result of some type of trauma, whether it's rubbing your eye very hard or an object flying to hit your face or your eye, anything like that. A couple of risk factors could include diabetes, high blood pressure, also known as hypertension, certain blood thinning medications, which can include warfarin or Eliquis or anything in that drug spectrum category, or even certain blood clotting disorders. Because as those blood vessels get damaged or as they burst or as too much stress gets imposed upon them on the front of the eye, that's what can cause blood to leak. It's like a pipe bursting and water just spews everywhere. But in this case, it's blood. And usually with subconjunctival hemorrhages, you can also experience them from a lack of sleep or high stress in your life, excess caffeine, or anything of that nature, whether the stress is emotional, physical, mental. It just can kind of put a stressor on the blood vessels in the front of the eyeball. Complications from subconjunctival hemorrhages are pretty rare, and usually they resolve within a week or two on their own. However, if you are taking some form of a blood thinner for medication, it may take a couple of weeks to fully resolve because those blood vessels are pretty tender and it may just take a little bit more time to heal it back up. But usually we don't see any complications from it. Let's say if it's an artery that bursts. Arteries are lined with muscular tissue and they usually force a lot more blood into certain areas and usually can result in something a little bit more gruesome looking, more like bulging out of your eye, basically. This can sometimes cause some irritation, and sometimes we put patients on some medication to calm it down, but it still resolves on its own within a matter of a week or 2 or 3, just depending on the background health history of the patient. Now let's move inward a little bit towards the iris, the colored portion of your eye. You can have some blood vessel breaks there too, as well as some traumatic injury and other health conditions and other ocular conditions, eye conditions, that can cause blood to collect in the colored portion of your eye, known as the iris. This can be usually referred to as a hyphema, which just means blood is collecting in the bottom portion or in any other portion around inside the colored portion of the eye. And sometimes it can fill up too, because we talked about previously in the glaucoma video that sometimes the drainage channel, the trabecular meshwork, can get clogged up and plugged up. Blood can do the same thing, where blood can clog up and plug up that drainage channel and fluid can't escape as easily, and it will cause the eye pressure to increase, which can also cause further complications for vision, for eye health, for visual quality, anything like that. Sometimes the blood will fill up the entire chamber of the front of the eye, right above the iris. We usually refer to this as an 8-ball hyphema. So if you've ever looked inside of an 8-ball or kind of know the shape or the structure of an 8-ball, this is pretty much what it looks like. The blood is very dark and is extremely difficult to see through. Now that requires some medical intervention and obviously some assistance to alleviate that. That doesn't go away on its own. So if you have that, please contact your eye care professional as soon as possible. You can also have a white version of this known as a hypopion. So what is a hypopion? Usually it results from some level of infection or trauma because instead of red building, it's white building. This usually means that there is a high collection of white blood cells for some reason that are collecting in the bottom portion of the eye, of the color portion of the iris, and are starting to fill up that chamber, meaning there is some kind of active infection going on, which means you need to see your eye care professional ASAP. And for a subconjunctival hemorrhage, you still need to see your eye care professional if you have any questions or any concerns, or anything like that. Now let's move to the back of the eyeball, known as the retina. That tissue that we've talked about that has all those photoreceptors, neuronal connections, anything like that. You can experience different hemorrhages and different blood breaks and different things of that nature there, whether it's due to medications, whether it's due to health conditions like diabetes or blood pressure or traumatic events or anything in that nature. And sometimes it happens for reasons we fully don't understand at this time. But you can have little dot hemorrhages that pop up as little pinpoint dots all over the retina. You can also have things that look like little flames called flame hemorrhages. You can also have certain things on the optic nerve, certain hemorrhages there. We like to watch that pretty carefully to make sure you're not at risk for developing glaucoma. But you can also have blood over the entire eyeball, whether a vein or an artery bursts in the back of the eyeball. Those can be a little bit more visually devastating and sometimes can require surgical intervention or injections or things to kind of calm that blood vessel breakdown, because there's a lot more delicate, sensitive tissue going on in the retina that can lead to further visual complications if not addressed quickly. You can also have certain conditions we've mentioned in other videos, such as a central retinal venous occlusion, a CRVO. You can also have a central artery retinal occlusion, a CRAO. You can also have a branch retinal venous occlusion, a branch arterial venous occlusion, things where they kind of branch off and cause issues in different areas of the retina. But again, the CRVO, the central retinal venous occlusion, can put a lot of patients at risk for developing a condition known as 90-day glaucoma. So if you experience any blood in the eye, any weird vision changes, any concerns, any problems, any issues, contact your local eye care professional as soon as possible so the questions can be answered, the conditions can be addressed, and if there's any treatment necessary or specialist intervention from ophthalmologists, for example, that can be warranted, that gets addressed as soon as possible. Because blood in the eye, it depends on the location, depends on the severity, and it depends on when it happened, because sometimes it can happen pretty quick, sometimes they take a while. It just kind of depends. You need to make sure you're in touch with your local eye care professional. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications. I'm Dr. Bryce Heffington, and we'll see you next time.